Hello. So today we're going to talk a little bit about TEER and preparation for our teaching. We'll start by looking at the context of the year, the overall structure, the breakdown of the learning week, and some comments on core conditions, types of sessions, and end on some good practice. So TEER is the first clinical spiral of the curriculum. It's the point of transition from focusing on clinical sciences to clinical practice. Students at this point are focusing on applying their knowledge and developing early clinical skills. And we're wanting students to be building a foundation for progression through their clinical years. Now in 2026-2027, the TEER will consist of 3 placement blocks, medicine, surgery, GP, and 3 PBL taught modules, medicine, surgery, and medical specialties. And we can look at the year as a whole, and we can see that the whole cohort will be split into 2 streams. So while Stream A will be going through their first taught module at the end of September, Stream B will be off on their first placement. And then they will alternate, cycling through until their assessments at the end of the year. Now let's zoom in on one week within the PBL taught modules. And you'll see that each of those weeks follows a set pattern. And this is particularly useful when you come to planning your sessions. So it will be really useful to come and look at the timetable and see exactly where your session sits within the week's learning journey. So before we look at the different components, it's useful to know that each week the students are working through a clinical case in their small groups. So in this week, students are covering a case on lower GI bleeding and colon cancer. In addition to working through this case, students will also have lectures and other sessions that feed into the clinical content encountered in the case during this week. So let's start with the Monday morning. Here we have sessions, usually, that follow on from the previous week's case. They're just closing off and concluding that subject area before moving on to this week's case. Monday afternoon, this is where students gather in their small groups to start working through their clinical case. Tuesday, they start with their lectures and other sessions that align with or support the case that they're covering. IOD is the outliers. IOD is investigation of disease. This sits Wednesday mornings, and these don't necessarily align with the week's clinical case. But if you take a step back, you'll find that these sessions are relevant to the modules in which they sit. Carry on to the Thursdays. These also add more sessions that support the week's clinical case. But Thursdays are asynchronous, and these are particularly good slots to include short cases that are good for students to cover that may not have been addressed elsewhere in the week. Fridays in the morning, students will gather again in their small groups to continue their clinical case now that they've gone through all these different teaching sessions and had some of their own time to do some independent learning. And Friday afternoon will be a clinical anatomy session in that same subject area. And finally, the following Monday morning, we will have, similar to this, perhaps a session or two to close off and conclude the case and content from this week. And one thing to bear in mind is that while students are, of course, working through the learning outcomes that are required of them for these sessions, they also have their core conditions. And core conditions all come along with a CSP rating. So CSP is comprehensive, standard, or principles, and this tells us and the students the required level of knowledge for each condition at their particular stage in the program. So surgery has their own specific definitions. So this is the link to these definitions here, but I've just copied them over onto the slide so you can also pause and read them off here as well. So what the students would likely do in this lower GI week is bring up all the core conditions of that same subject area. So here I've quickly brought up the GI and liver core conditions along with their CSP ratings. Since this is a surgery module, I filtered it further. So now this is the GI and liver and surgery core conditions along with their CSP ratings. and I can filter it further to only look at conditions that are relevant to the lower GI. This is quite useful, not just for the students, but in informing how you approach your teaching and designing your content. So if you do mention any condition from the core condition list, we would recommend that you look at the CSP rating and identify exactly what content and what level of depth is required for these students at this particular level to inform how you design your material. So there are two types of sessions essentially during these weeks. So some sessions will focus on a condition. And in these sessions, it's important to be aware of the CSP rating so that we know we are covering the condition to an appropriate level of depth. Or if we're going above that level, we are signposting it clearly to the students. The other type of session focuses on a clinical presentation. So in this scenario, you'd present a presentation, and then you might use a case-based approach to demonstrate the different things it could be. And the focus in these types of sessions is on making the surgical diagnosis and management, but of course informed by the level indicated in the CSP rating. So just some generic tips that just follow on from what we've been talking about. So with regards to LOBs and core conditions, so the curriculum, it is good practice to, at the start of the session and at the end, if convenient, to signpost clearly the learning outcomes as well as the core conditions that might be covered within that particular session. Remember to be intentional with the inclusion of additional content beyond the LOBs. These students are at their first stage of their clinical learning, so it's still very early on in their clinical journey. In terms of session length, plan for sessions that are scheduled for 1 hour to last up to 50 minutes to allow some leeway for overrunning double bookings, late starts, or whatever it might be. And also give yourself and students regular short breaks or a change of pace during each session. Ensure the content is kept relevant and aligned with the core condition list. Of course, as things might be changing in the curriculum, it's important to make sure that we're updating all our material appropriately. Provide case examples and practice questions where possible. So wherever appropriate, wherever relevant, these are very good ways for students to learn to apply their knowledge or learn to make the link between taught content and how they might be assessed. And finally, remember to write assessment questions as you are preparing and updating your session materials, because of course the assessment team will at some point be making contact to request those for the students' assessments. Thank you so much. I hope that was clear, but if you had any questions or any concerns, then please do get in touch with us, the curriculum team, at this email address on the screen. Thank you.